All right. Good morning, and welcome to everybody watching to our first and exciting episode of Healthcare Trailblazers. We're very excited to have Charles Haberkern here. Charles is an amazing and serial entrepreneur, working through his time in building tremendously successful healthcare organizations all around the United States, and currently has built the one of the top 10 largest rheumatology practices in the U.S. and the largest in the couple states around us. So he's got a tremendous amount of wisdom and knowledge that he's gained along the path to share. We're very excited to have you. Thank you for coming in.
Thank you, Mendel. It's a pleasure being here.
Amazing. So we'll go all the way back. Let's take a trip down memory lane.
That's a long time ago.
Yeah, let's start all the way back. So you were in high school, and my understanding is you pretty much started working right off the bat. So yeah, what?
I started working when I was 16, and I ended up working for a gentleman that was an entrepreneur. And at 18, I was managing a store for him, and had more money than I knew what to spend it on. I had a brand new Camaro and
Wow.
bought it right off the showroom floor, and I thought, wow, life is good. But I started thinking, this is an hourly job. I was in college. I did 1 year of college, and in that 1 year of college, I probably ended up with half a year's credits.
Right.
And I decided to join the Army, so I enlisted and spent 3 years in the Army. Made sergeant after less than a year and a half, and was in charge of about a 25-man unit and at Fort Lewis, Washington. Then went to Germany for a year. Was a section chief there for a nuclear missile unit.
Oh, wow.
And started taking college classes while I was in the Army, and when I got out, went straight to school and paid for myself, put myself through college, and I graduated almost 4 years to the day that I got out of the Army, and got a degree in accounting because I knew if I had a degree in accounting, I was going to get a job right out of college.
Okay.
And I didn't want to be a CPA because I didn't want to see what happened after the fact. I figured if I knew the numbers, I'd be able to get a job, and I always wanted to be in operations and be there when it happened, not looking at it afterwards.
Very interesting. Yeah, and a lot of people today talk about the big debate: going to college, not going to college. And it seems like first of all, it seems like management was screaming out of your DNA from pretty much day one. And then it seems that you went to college with that kind of foresight, understanding you were going to take accounting, but to help you in business. And has that panned out?
Yes, and I'll tell you, it a lot of it stemmed from being in the Army, and people, sometimes people say, well, you don't learn anything. I was 19 years old when I got out of basic training and advanced training, and absolutely, I took over a unit in Fort Lewis, and I ended up being the battalion training NCO.
Wow.
I had to start giving classes to 150 people, so I had to learn public speaking. I had to know what I was talking about. And I mean, some of the people that reported to me in my section had been in Vietnam.
Wow.
They were 5-6 years older than me. And so I had to learn how to manage people. And that helped me after I got my degree in accounting and I got my first job. And they hired like 8 of us staff accountants at the same time. I was the first one to get promoted to a department manager position, and then I ended up being the credit manager for a $40 million company 2 years out of college. And
what kind of company was that?
It was actually in agriculture.
Okay.
It was a Superior Farming Company, and it was owned by Superior Oil Company. They had 30,000 acres.
Wow.
And, everything from annual crops to almonds, pistachios, things like that. So I stayed in ag-related for a little bit, and then ended up, a friend of mine was a partner in a CPA firm and came to me and said, "Hey, how would you like to change jobs?" I said, "Well, it depends. Will I make more money?" And
that's an important factor.
He said, "Probably." So, and it was in healthcare. So I went in, he set up an interview, and the doctor that owned it was like a super entrepreneur. I mean, this guy is a multi-millionaire now. So I interviewed with him for about a month.
Okay.
And he and his medical director were giving me things. Well, what would you do in a situation like this? And so after about 3 weeks, I figured out that he was having me fix problems at the medical group. And so
through
finally,
your interview process?
Yeah. and so I, finally, I told a friend that was a partner, I said, "I'm done with this. He's either going to hire me or I'm done." And it was like he's giving me case studies. And so I went in and said, "Look, this is what I would do in this situation, and I'm done." And he said, "Well, we want to hire you." And I said, "Well, make me an offer." And so the next day, I had an envelope hand-delivered.
Sorry, how old were you at this point?
Let me see, maybe 26.
Okay.
And so they made me an offer, and it was like $10,000 too low. And so the courier was leaving, and I wrote in here, "No thanks." And I said, "This is what I need." And I said, "Take this back." So they called me immediately. "Well, we can't pay you that much." And I said, "Well, thank you very much." So later on that afternoon, another courier shows up where I'm working, and the owner is going, "What's going on?" So I open the envelope, and it's what I needed, and so, "Well, I have to give you my notice, and I'm leaving." I was hired as a controller for a medical center, but it was really a medical center of two 40,000 square foot buildings, and all employed physicians, and it was really, really interesting. This guy was making so much money, he didn't realize how poorly run it was. I mean, the receptionists, we had 8 reception areas. Receptionists were stealing co-pays. One receptionist was stealing $100 a day.
Oh boy!
And it was just it was a madhouse. So I just started fixing things, and I was stepping on the toes of the administrator.
And again, you're 26 years old at the time.
Yeah, and I've always, if something needed to be done, I would do it.
Yeah.
I didn't wait for people to say, "Why don't you fix this?" If the trash needed to be emptied, I'd empty the trash.
Mm-hmm.
Whatever needed to be done. So I started firing people. Started reconciling all of the reception areas every day and making them sign for it before they put it in the safe. And I think in the first 2 or 3 months, I think I fired 30 or 35 people.
Wow.
And morale went up because people were doing other people's jobs because there were horrible people working there.
Yeah.
And so it really upset the administrator, and she called the owner, and he came up from L.A., and what I did, there was such a disparity in what people were being paid. After I fired, say, 35 people, salary and benefits was over $1 million. I gave out like $300,000 in raises to get everybody getting paid comparably. Well, the owner came into town yelling and screaming, and he was a yeller and screamer.
Oh, boy.
And he said, "What in the heck are you doing?" So I'm in the meeting with him, the administrator, and I in the big conference room. You can't do this. You gave $300,000 in raises. And I said, yes, I did. And I had all my paperwork that the administrator didn't know about. And I said, but I also saved you over $1 million. What are you talking about? So I showed him everything. And he looked at the administrator and said, Catherine, Charles is now the senior VP of operations, and you report to him.
Wow. That's incredible.
We ended up being friends.
Okay.
But, this guy ended up owning medical groups and taking full risk contracts all over California, Texas, Florida, New York. He's semi-retired now, but just an amazing guy. I learned so much in healthcare from him.
Wow. And that experience.
Yeah.
So just to kind of go back to that entire little part of your life, you're 26 years old, you're turning down a salary, right?
Mm-hmm.
You're taking a senior management position, you're firing people, I would imagine older than you at that point.
Oh, yeah.
For the most part. If you could try to like go back to your mind then, like I would imagine a lot of people would say that takes a lot of confidence to do. What do you think was driving you to tell you that you were confident enough to turn down a salary, to start, to actually really perform in that position that you were given?
I was making at the current job, I was making enough money that unless they made it worth my while, there was no sense in leaving. I'd been there a couple of years and had a very good future. And I mean, again, I just have to go back to the confidence in myself that I learned in the military. I went to NCO Academy. I went to advanced leader training. All sorts of things, that the military actually trains you for. And it was like, I had nothing to lose.
Yeah.
No, that's not what I'd really like to come to work for you, because healthcare really looked interesting, but it has to be on my terms.
That's an amazing thing.
Yeah.
And that's clearly that's actually what works,
Mm-hmm.
Incredible. Okay. So you had this experience there that spanned a number of years that you were at this healthcare company initially?
Probably say 3.5. And then I was, a friend of mine was in a competing medical group in California, and he was acting as a consultant with a group of physicians in several counties north of us. And they wanted to start a physician hospital organization and an IPA, an Independent Practice Association. And he said, look, my job is so big, I don't have time to do this. Will you go up there and do it? And sure. So I had to form the IPA first.
Okay.
And the hospital was willing to put in money to start a PHO. And so I was the first employee of the IPA, and I was the first employee of the PHO. And I did everything from empty the trash, figure out what computer system to buy, lease office space, hire my first employees, and just move forward. And we put together the IPA, and I signed up initially about 80 doctors, I believe, all in the county, and we formed the PHO. The hospital had an attorney. I'll never forget his name, Scott Roman. And he was down in Orange County, and he helped do all the legal paperwork, and he ended up being huge in the managed care arena. And so we put together the PHO, and we were one of the PHOs back then that was actually successful. A lot of them lost money. I ended up signing up 4 other hospitals, so we had 5 hospitals in the PHO. and probably over 300 doctors in the IPA. And it was, I remember the first year, I actually have a picture somewhere of a check for $500,000 that was a bonus to the owners of the IPA, and they just couldn't believe it. I actually ended up giving presentations all over the United States, in Albany and Rochester, New York, Raleigh, Durham, Utah, New Orleans.
Wow.
I mean, all over, because we were successful. Atlanta.
And just like, for some people watching, you say a lot of these things just off the cuff, but enrolling initially 90 docs, growing that to 300, signing up hospitals, that is a very big task. As somebody that that deals with talking to doctors and trying to educate them on services and things, they're very challenging to get to. Every single one of those, I'm sure, was quite a challenge.
It was, because you have to tell them, we're going to be paying you. The insurance company isn't going to pay you anymore, because the insurance companies were giving us the money. And I had to go out and negotiate a contract with, say, an orthopedic surgeon, and maybe offer him a little bit less than what he was currently getting from, say, Blue Cross. But I'd say, but you're going to get 100% of all of the patients from these 100 doctors. And so, it's kind of, trust me.
Yeah.
And it ended up working. And, some of the, back then it's called capitation. You get per member per month, the primary care. And you say, okay, well, we're going to pay you $10 a month, and you have 1,000 patients. Well, I can't treat a patient for $10. No, you don't understand. You're only going to see about 20% of your patients a month. I'm going to give you $10,000, and so they think they're going to see all 1,000 patients every month, but you don't.
Yeah.
And so I'd go in and look at their practice and say, okay, look, this is how much you make from regular insurance. So I'm going to be paying you $10,000 a month. So take the money you get from your regular insurance payments, pay all your bills, pay your staff, pay your rent, and put the $10,000 a month in savings. Or if they had enough patients, I'd say use your capitation money to pay all of your bills and bank the other one. And so I ended up helping a lot of practices understand managed care and capitation. And actually, through the PHO and the IPA, we ended up acting as a consultant and helping a lot of practices that needed help. The doctors are working, 50, 60 hours a week and making $150,000 a year back then, which was, they could go do something else and make that much money. They were killing themselves. So we, I hired some good people, and we went in and started helping them, and maybe they're starting to work 45 hours a week or 40 hours a week and making more money.
Yeah. And under that arrangement, were they able to keep their autonomy, or were they completely part of the organization?
No, they had their outside business, and we were just like an insurance company to them.
Okay.
So no, we were just a portion of their business. But what we would act as consultants for their entire practice, not just our part of it.
Yeah, that's really cool. And were you guys implementing any kind of when you're taking on risk, you're trying to keep, like you said, you want to only be seeing 20% of those patients, which means that you're trying to keep the entire 1,000 patients healthy. Was there any preventative measures that were kind of put into place?
We did all sorts of things. We actually paid for things that weren't even benefits under their plan. I remember a lady that had migraine. She was going to the emergency room 4 or 5 times a month.
Oh boy.
And back then, Imitrex was it was an injection, and so I worked out a deal with a pharmacy that she had an open prescription. I had one of my RNs teach her how to inject herself. And, gosh, I mean, emergency room visits. She'd go there and she would get an injection, but we're being charged $300 a visit. And her emergency room visits dropped to maybe 1 a month, sometimes none. And she was better taken care of. So another person was in a wreck and waiting for, if the other person had insurance. So it came to the day where this person, he wasn't, his legs were in casts, and the guy was it was a mess. And it came to the day where he wasn't medically able to be in the hospital anymore. So he was going to be discharged, but I was going to have to go and tell him, look, we're not going to pay for your hospital stay anymore. He had, no support or anything else. So my utilization review nurse contacted one of our durable medical equipment companies. We got him a hospital bed. We got everything set up in his house. We did all of this stuff. We paid for it out of our money, got him out of the hospital, took him home in an ambulance, and actually got him a home health nurse that would go in and visit him a couple of times a day. And, we paid for that ourselves. And it was part of taking care of the patient rather than worrying about, was this a benefit of his health insurance. So, there are all sorts of things. If you take better care of a patient, every step along the healthcare line costs more money, and it's worse for the patient. If you can take care of them in primary care, that's better than having to go to urgent care. If you take care of them in urgent care, it's better than emergency room. If they have to see a specialist, all along the line it costs more money. So if you keep patients healthy, it's not only better for you, it's better for the entire healthcare system. The only people, it's also better for the insurance companies. They make more money if there's no claims.
Yeah.
So, unfortunately, most of the time they don't share that with the doctors.
Right. But, it seems to me, and correct me if I'm wrong, but it seems to me that a lot of the things that you're talking about are just, even now, kind of sort of slowly becoming more popular. You must have been, these programs must have been way ahead of their times.
We were cutting edge in California. In fact, a lot of the stuff is still going on. We actually had an HMO license. It was called a private label back then, and that allowed us to get all of the money and negotiate rates with the hospitals. I love the East Coast. I came back in 2012. I have talked to healthcare companies. I've talked to the companies I've worked with. We should try this. We should try this. Charles, no one's doing that here on the East Coast. We're looking at value-based care now. We're looking at shared savings plans. But I haven't seen, there are companies that are taking full risk and going out, or even risk on the physician side, but nothing like what's going on. I was in Arizona too. California, Arizona, big on taking risk. And I think it's great because it allows you to take, I think it allows you to take better care because insurance companies are transaction related companies. A lot of times they just tell you no, but they don't give you alternatives. I mean, I had nurses working for me. I had doctors working for me, and we were constantly looking for alternatives, not waiting until somebody needs to go to the hospital.
Yep. Yeah. And I mean, I think there's no question that it's better care, it's smarter care, it's more efficient care, and efficient in both senses, meaning for the patient as well. You're, in that kind of scenario, it's a total mind shift, where your money comes in from, and where in a fee-for-service kind of world, it starts totally turning on its head, where in a fee-for-service world, the things that made you your most money now in a value-based kind of setting become your biggest liability, and you're trying to prevent those things.
Absolutely.
And that's amazing for the patient.
Right. Right. If you're looking out for the patient's care, like I said, we paid for things that weren't covered benefits, and it would cost us a little bit out of pocket, but it ended up saving us money long term, and the patient was better off.
Yeah. It's one of those things where patient care and good business sense actually align.
Back in the 90s, we actually, I can't remember the name of it, but we had a huge Medicare Advantage. It wasn't called that back then, but it was a Medicare. We took full risk on the Medicare patients. We were paying for their gyms. I think it's called Silver Sneakers now. Okay. But back then, we were paying for the seniors to have, gym memberships. We had group meetings. We had all sorts of things, just attempting to keep the seniors active. Group meetings about, diets and hypertension and diabetes we had the money, so we were able to do things like that and pay for it, and look at results. Is this lowering our cost for diabetic patients? Are sending people to the gym or paying for them for the gym? And we would get results, because every time they went, we'd get information every month on who went to the gym, how many times. And, if somebody wasn't going to the gym, we'd send somebody, we would call them and go see them. Look, we'd like you to go to the gym. Well, I don't have a car. Okay, so we'd figure something else out. So it was just, it's to me, and a lot of that's going on now. The health insurance that we have at my current job, I mean, you can, if you go to the gym, they give you X amount every year to pay for the gym. If you see, they actually send a registered dietitian to our office and talk diet with everybody who signs up. So, that part of it is working, but the other part of it, where the insurance companies are actually directly involved with your care and actually looking out for you, is what I think is missing on the East Coast.
Interesting. Yeah. And like you said, a lot of that is just communication with the patient. A lot of times there's a simple underlying reason why they're not taking those measures, whether it's, like you said, going to the gym or going and filling their prescription. And,
right.
Obviously we see a lot of success with that, with the, chronic care management, the preventive programs that we run. But 100%, a lot of times organizations aren't necessarily equipped to provide that kind of communication. But it could be a very simple reason. And that's amazing that you're able to send people out there and kind of get to the underlying reason and get that fixed.
Well, we see in rheumatology, rheumatoid arthritis, psoriatic arthritis, lupus, gout, things like that. We find out, somebody may have a flare and I have to come in. I'm in pain. And, we look, when was the last time you had your prescription filled? I skipped it last time. They don't take their medication, or they were scheduled for infusion 2 weeks ago and they canceled.
Yeah.
And, once you start the infusions and the medications, the biologics, you need to stay on it. It's not something that really goes away. It's a lot different than oncology and getting your infusions or the cancer drugs there. Unfortunately, the ones that don't work, the patients die. With rheumatoid arthritis, some of our patients have been seeing our doctors for 20 years.
Wow.
But you see people not staying on their medications, and people that are in the hospital, have surgery or have some type of disease. The biggest problem is a lot of them not taking their medications, and just something simple, having a home health aide or a licensed vocational nurse or LPN stopping by for a couple of days after post-discharge and are you taking your meds? It's as simple as that. Doesn't cost much money, but it keeps somebody from having a relapse, going back to the hospital, or the symptoms returning.
Yeah. So you made a number of stops along the way. You were in California for a couple of years. You mentioned Arizona, Maryland. Was it
Yes.
Maryland? Maryland for a bunch. And along the way, you've built up just a bunch of these different healthcare organizations and have made them tremendously successful. In your current position with the rheumatology practice, my understanding is that you've increased revenues by over 100%
Yes.
since you've started. That's incredible. Grew the number of doctors to, was it 18?
I'll be making an offer probably tomorrow. I received her references yesterday, so we'll have 18 providers, 17 doctors, and 1 nurse practitioner.
Wow.
I think when I started 4 years ago, I think we had 11 or 12, and we have 6 offices. As you mentioned earlier, we're the largest privately owned rheumatology practice in New Jersey, Pennsylvania, and Delaware.
Incredible.
Some of the academic centers may have more rheumatologists, but we're physician-owned, and that was one of the main reasons I took the job, is they never want to be owned by a hospital.
Yep.
So that led us into what we're doing now. We formed a new medical group, new tax ID number, and we formed a management company in order to allow smaller rheumatology practices to merge with us so they can stay independent.
Wow. That's just recently, right?
Yes.
Yeah. That rings of kind of some of your earlier experiences. How would you say your different stops along the way have what experiences have you gained and rolled over into each new, with each new learning experience to what you're doing now?
I've done a lot of mergers, a lot of acquisitions, recruiting, and you find out a lot of, I can't say a lot, many physician practices are not well run. They're okay. They're making, money, but they don't realize some of the money that is just escaping. So managing a physician practice and taking all of the administrative load off of a physician, allowing them to just see the patients. They don't have to worry about negotiating a new lease. Their lease is coming up. Negotiating a new contract. Your receptionist is being rude to the patients. A lot of physicians end up, rather than disciplining or firing that person, they hire somebody else to sit there with them. So they're spending more money rather than taking care of the disruptive employee. So we take all of that off of them. In rheumatology, you have to get pre-authorization for the infusion drugs or the injections, and some of the small practices don't do it because some of these drugs are very expensive, and if you screw up and give one infusion that's not authorized, that can blow your whole month.
Wow.
So we do all of that, and mean, we're able to do that for other practices. I mean, some of the medical groups that I've worked for have been hospital owned, and even in those situations, the hospital is writing them a check, they're on the payroll, and things kind of get sloppy. The physicians think, well, I don't have to work as hard anymore because I get, I'm on salary. So you have to fix that. And it's every single job that I've had, it's all the same. It's taking care of patients, but every single job is different because there are different opportunities. There are different, you look at a SWOT analysis, strengths, weaknesses, opportunities, and threats, and you take care of them. You have to look at it with a strategic eye rather than just a plain, operational. You have to fix operations, but then you have to think about where can this group go? Where can this company go? Where can this doctor go?
That's a very interesting distinction between being operational and being strategic.
Mm-hmm.
That's quite fascinating. Wow.
Yeah, the physicians I work for are just phenomenal. Not just the owners of the group, but the physicians that we've been able to recruit and help grow the practice. I think they're probably some of the best group of physicians I've worked with. And you and I were talking before the cameras turned on. I'm having fun. It really is I tell people healthcare is a great industry to be in, and healthcare is a business. Some patients don't like to hear that, but unless the doctor is making a profit, they're not going to be in business.
Yeah.
So we do the business side and let them do the medical side. But every opportunity that I've been presented, it's been different, and there have been ways to improve, not necessarily fix, but ways to improve at every stop along the way. And I look forward to our new path, with the new medical group and the management company, because it really gives us an opportunity to help some of the other practices in our specialty. Some of the smaller practices don't even do infusion, so that's one of the first things that we would be able to offer them.
Yep.
We'll do the authorizations, we'll buy the drugs, we'll keep the inventory, we'll do everything. All you have to do, we'll find an RN for you who can do the infusion, and it makes it not exactly painless for the practice, but a lot less painful than if they wanted to do it themselves.
Yeah. And what I personally, I think one of the fascinating points that really stand out to me about your whole kind of journey thus far, and I know you're just getting started with all these different stops, but a lot of people out there talk about how everyone, how the best thing out there is to be an entrepreneur in the sense of, go live in your parents' basement, eat ramen noodles, and, go rough it out for years and years and years. And I think not to knock that, obviously that's the right path for a lot of people. And I understand that there were parts of different companies that we didn't even touch on that you started yourself. But a lot of these positions were companies that you joined, and you used your entrepreneurialism to really jump into some sort of structure, but build it up and make it tremendously successful.
There are opportunities if you're willing to go beyond what you're hired to do. If you see something that needs to be done and you don't do it, then you've lost that opportunity. Almost every job that I've had, even before I got into healthcare, if you're willing to work hard and maybe you can't fix what you see is going wrong, but you have to let somebody know, hey, look, I see this. I don't know what to do, but I think we should fix this, or I see an opportunity here. If you point enough things out, you're going to realize next time, I don't have to point it out to somebody. I can do it myself. I've always been, don't ask permission. You just do it. And sometimes you're going to do the wrong thing. Everybody makes a wrong decision from time to time. And when I start a new job, I get, all of the management staff together and say, look, I'm not going to make all the decisions for you. If I have to make the decisions for you, why are you here? I attempt to push decision-making down to the lowest level that's reasonable. And I tell them, you'll never get fired for making the wrong decision. But if you habitually make the wrong decision, then we're gonna have to have a talk, on your decision-making process. And I say, look, you usually get it down to a point where I can either do this or I can do that. And if you do that and it's the wrong decision, maybe you need to think, man, I should have done this, and you fix it. But if you really don't know what to do, come to me and we'll talk about it. But you have to bring a solution, and we'll talk about your solution. And over 90% of the time, it's something that I have seen, and I'm not going to tell them what to do. What do you think we should do? And we sit and talk about it, and if they come up with a way to do it, and it's not exactly the way I would do it, but it's going to get the job done, let them do it, because they own it.
Yeah. And you would say that, that non-micromanaging, the opposite of micromanaging, has been tremendous, has clearly worked for you in a leadership role.
Absolutely. And you're going to find out that people are happier. They take ownership of their job. And I'd rather have them come and tell me, hey, this is what happened, this is what I did. And then I say, okay, well, next time, just send me an email.
Yeah.
But I always give credit for the things that my management team does. At our last board meeting, my director of operations, one of the insurance companies is just horrible. She has been on them for since September. We changed tax ID numbers, and all you have to do is send a letter with all the doctors' names and their NPIs, say this is our old tax ID number, this is the new one, and they're supposed to just move your contract over. One of the insurance companies paid us at the wrong rate. Of course, it was much lower. So since September, she has been on them and on them and on them. And what she did, she finally found like an employee page on Facebook. So she put on there, this is my last opportunity, and she wrote this long message on there, unless I hear from you, I am going to blast you all over Facebook. The next day, she got a phone call.
Wow. From
the person she had been attempting to talk to since September. They're paying us, they're retroactive, all the way back to September. They're retroactively paying us the right amount. And the lady said, I understand you want to renegotiate your contract. Yes. Okay. So this is the person you need to talk to. It was hilarious. She wrote this all out. So at my board meeting last week, I let the partners know, hey, Jen did this. I want you to know exactly what she did. And because if I don't tell them, they're really not going to know everything that everybody does. My controller renegotiated a contract that saved us like $40,000.
Wow.
And, I let them know about that. One of the people in billing the insurance company denied a $15,000 payment on 2 infusions, said we didn't get authorization. They sent her denials 3 times. She wouldn't let up. She finally got it paid.
Amazing.
Other people, other companies I've been with, I tried. What's $15,000? She got us paid $15,000 that other people would have just said, you know what, I'm tired of working this claim. So I make sure that that sometimes it's just the partners that I let know. Other times I let all of the doctors know that, hey, this just happened, and whether it's one of my management team or one of the staff employees, it's the old adage, never take credit for anyone that works for you, what they've done, and take all the blame but none of the credit. And if you do that, you're going to find out you're going to be successful.
Yeah, and I would imagine that, you said the distinction between some of your employees going that extra mile. I would imagine that culture that you're creating, where you are crediting those that are actually responsible, plays a big part in creating that kind of culture.
Absolutely, they do go the extra mile.
Yeah.
Getting recognition, just stopping by and telling an employee, hey, look, I heard you talking to a patient yesterday, and you took care of their problem. It wasn't even your area. But you took care of the patient, made them feel good, and you make sure that there are a couple of other staff members around when you tell them what a great job. We have $25 gift cards, and every Wednesday at 7:30 I have a managers meeting and say, okay, who has something that one of their staff did last week? And so a couple of the managers will say, well, this person did this. Well, that's really just their job. So no, that's not anything special. But we'll find something special, and after the managers meeting, we'll go and get a $25 gift card, and like 5 or 6 of the management team will go up to their desk, go to the front desk, wherever they work, and just thank you and give them a $25 gift card. And it's amazing that before you can get back to your desk, other offices know that so-and-so got a $25 gift card.
That's amazing.
And $25, it's like, but when you're making $16, $17, $18 an hour, it's like, wow, this is, I can buy lunch tomorrow. Or, my husband and I maybe this will buy us drinks when we go out to dinner.
Wow.
It's just little things that make things so much nicer for the people that work for you, because no matter how good you are, you can't do it all.
Yeah, that's a tremendous leadership nugget right there. I think if there's even one small part to take from this, that's an amazing practical thing that you can put into your organization to kind of create a really healthy employee culture with obviously the problems that are going on today with employees not necessarily going that extra mile. So I find that to be amazing. Charles, this has been an incredible one of the quickest hours, I think, of my life. And I know there's so much more that we can cover.
It's amazing. Like I said, it's fun. I'm still having fun, and I appreciate meeting you and seeing what you and I are going to be able to do at some point together.
Absolutely, I look forward to it. If there's a practice that's trying to maybe hop onto your new management company, or how do people reach you?
We our website is arthritissj.com, Arthritis Southern Jersey. Our management company is Trabecular Management Services, but Arthritis SJ is our website, and I'm on the website. There are, if you look for rheumatologists in New Jersey, our SEO gets us at the top almost on every time you look.
Amazing. So yeah. not very hard to find you.
Right.
It's been this has really been really fun. I really appreciate you taking the time coming down here, and hopefully we chat again.
I loved it. Thank you, Mendel.
Amazing.